New tonight at 11. Construction is about to begin this spring on a first-of-its-kind mental health treatment facility in Grove City that will serve children and teens throughout the region and state. It's a collaboration between the Buckeye Ranch and Nationwide Children's Hospital. The heart of the matter, it will serve as a bridge between the hospital and home.
This virtual fly-through is a first look from the Buckeye Ranch of their plans for a 48-bed residential treatment facility. In partnership with Nationwide Children's Hospital, it will be a place for young patients to focus on their mental health journey once they leave the hospital and before they return home.
I think it is important that we have facilities like that.
Amber Anderson spent most of her childhood in the foster care system, including in a residential program with the Buckeye Ranch. Having lived through her own mental health journey as a teen, she says this facility will help other teens, not so much because of the physical space itself, but because of the team there to provide support.
I think that the biggest thing is just, like in the struggles, in the pain, stay strong, because whether you believe it or not or see it, you have so many people around you rooting for you.
We all know that there's stigma out there with mental health, and we want to be able to get in front of it.
Kimberly Miller and Christina Massey from the Buckeye Ranch say there's a need for this level of treatment here in Central Ohio. They explain exactly how it will help.
The Buckeye Ranch currently has a residential facility, but children that are admitted into the residential facility are normally stabilized on medication. So there is a gap that we discovered between an acute hospital setting and a residential setting.
We have within our community a group of youth who are struggling with chronic feelings of self-harm, chronic feelings of suicidal ideation, are having more aggressive types of behaviors that they're showing as they're working through treatment.
And it's really for those kids that are stepping down from the hospital that aren't quite stabilized on their medication. They need psychiatric and medical and behavioral health follow-up.
And most importantly, they say teens would no longer have to go out of state for this type of care, a commitment to what they call modernized mental health care.
This new build is going to really help the community see that we understand there are all different levels of mental health.
They expect to break ground this spring and open in 2 years.